The Vestibular Ocular Motor Screen, or VOMS, was developed and validated to screen for vestibular and ocular motor impairment and symptoms following MTBI. The VOMS is a 5-minute clinical screening tool that can be deployed with minimal training and materials. Our research indicates VOMS was 90% accurate in identifying patients with MTBI from healthy controls. These findings suggest that VOMS may augment current clinical screening tools such as the SCAT5 and MACE used by the U.S. military. This video will provide an overview of the VOMS and training instructions for the VOMS. The VOMS consists of patient-reported symptoms of headache, dizziness, nausea, and fogginess at baseline or pre-test and after testing 6 visual domains. Following each domain assessment, patients rate their symptoms on a scale of 0, no symptoms, to 10, severe symptoms, for headache, dizziness, nausea, and fogginess. Near point of convergence is assessed by both symptom provocation and NPC distance. Normal NPC distance is a measurement under 5 centimeters. The VOMS can be performed in about 5 minutes. To perform the VOMS, you will need a soft tape measure, a metronome or metronome smartphone app, and a fixation stick or discrete target. On the VOMS scorecard, symptoms are found in the columns and the testing domains are in the rows. If a participant cannot form one of the assessments due to injury constraints, mark the not applicable column and add a brief note in the comments column. The first step in the VOMS assessment is baseline or pre-test symptom reporting. Ask the participant to rate the following on a scale of 0 to 10, with 0 being no symptoms and 10 being the most severe symptoms: headache, dizziness, nausea, fogginess. Record the symptoms on the VOMS scorecard prior to moving on to the testing domains.
So Cindy, before we start, I want to know on a 0 to 10 scale, 0 being nothing and 10 being symptoms the most extreme you could imagine. Do you have any headache right now, 0 to 10?
2,
Dizziness?
0,
Nausea?
0,
Fogginess?
0.
The first screening domain is smooth pursuits, which tests the ability to follow a slowly moving target. The patient and the examiner are seated. The examiner holds a fingertip at a distance 3 feet from the participant. The participant is instructed to maintain focus on the target as the examiner moves their fingers smoothly in the horizontal direction 1.5 feet to the right and then 1.5 feet to the left of midline. 1 repetition is complete when the target moves back and forth to the starting position. 2 repetitions are performed. The test is repeated with the examiner moving the target smoothly in the vertical direction 1.5 feet above and 1.5 feet below midline for 2 complete repetitions. Give the following instructions to the participant. Follow this target with your eyes without moving your head. After completing smooth pursuits, ask the participant to rate the following on a scale of 0 to 10. Headache, dizziness, nausea, fogginess. Record the ratings on the scorecard.
Okay, so now I'm going to ask you about those symptoms after each test. So the first thing is you're going to follow the tip of my finger with just your eyes. No moving your head, so just move your eyes slowly to follow my finger. Good. Okay, so right now, headache 0 to 10.
Still a 2,
Dizziness,
0,
nausea,
0,
fogginess.
0.
Okay.
Horizontal saccades test the ability of the eyes to move quickly between horizontal targets. The examiner holds 2 single points horizontally at a distance 3 feet from the participant and 1.5 feet to the right and 1.5 feet to the left of midline, so the participant must gaze 30 degrees to the left and 30 degrees to the right. Instruct the participant to move their eyes as quickly as possible from point to point. 1 repetition is complete when the eyes move back and forth to the starting position. 10 repetitions are performed. After 10 repetitions, ask the participant to rate the following on a scale from 0 to 10. Headache, dizziness, nausea, fogginess. Vertical saccades test the ability of the eyes to move quickly between vertical targets. The test is similar to horizontal saccades, except the examiner holds 2 single points vertically. Instruct the participant to move their eyes as quickly as possible from point to point. After 10 repetitions, ask the participant to rate the following on a scale from 0 to 10. Headache, dizziness, nausea, fogginess.
Once again, without moving your head, just your eyes, you're going to move your eyes to look at this point and this point, back and forth as fast as you can go. And we're going to go 10 times. So go ahead. 1, 5. Good. And then stop. So symptoms now: headache 0 to 10.
Still a 2.
Dizziness.
0.
Nausea.
0.
Fogginess.
0.
Okay, I want to know how this movement feels. So you're going to move your eyes up and down to these 2 points as quickly as you can. We're going to do 10 times. So go ahead, up and down. 2. Good. All right. So headache now.
2.
2 still. Dizziness at all?
0.
Nausea?
0.
And fogginess.
0.
Near point of convergence, or NPC, measures the ability to view a target without double vision. The examiner seated in front of the participant watch eye movements during this test. The participant focuses on a target at arm's length and slowly brings the target towards the tip of their nose. The participant is instructed to stop moving the target when they see 2 distinct images or when the examiner observes an outward deviation of one eye. Blurring of the target is ignored. Measure the distance from the tip of the nose to the stop target in centimeters. Repeat the test 3 times. An abnormal NPC is greater than or equal to 5 centimeters. After 3 measurements are recorded, ask the participant to rate the following on a scale of 0 to 10. Headache, dizziness, nausea, fogginess.
The next thing I'm going to have you do is look at this little target. It's got an A on it. And have you hold it out at arm's length. You're going to bring it in towards you and stop if and when the A splits into 2. I don't care if it gets blurry. I only care if it splits into 2, if it doubles. So you're going to bring it in towards you. Right there. Okay, so all the way to your nose. All right, take it all the way out. I'm going to have you do that again. Bring it all the way in towards you. Stop if and when it splits into 2. Bring it up there. So I'm going to measure that point. That is 4 centimeters. All right. And then can you do that one more time? Bring it on in towards you. I'm going to have you stop it right there because I see one of your eyes drifting out. So let me take a measure there. Okay, and that is 9 centimeters. Okay. All right, and how about symptoms at this point? Headache, 0 to 10?
2.
Still a 2. Dizziness?
0.
Any nausea?
0.
And any fogginess? 0. Okay.
The vestibular ocular reflex, or VOR, assesses the ability to stabilize vision as the head moves either horizontally or vertically. The participant and examiner are seated. For horizontal VOR, the examiner holds a target 3 feet for the participant, or the participant holds their arm straight out with a thumb up. The participant is instructed to rotate their head horizontally while maintaining focus on the target. The head is moved at an amplitude of 20 degrees to each side. A metronome is used to ensure the speed of rotation is maintained at 180 beats per minute, 1 beat in each direction. 1 repetition is complete when the head moves back and forth to the starting position. 10 repetitions are performed. Instruct the participant to focus on the target while demonstrating the speed and amount of motion required. After 10 repetitions, wait 10 seconds, then ask the participant to rate the following on a scale of 0 to 10. Headache, dizziness, nausea, fogginess. The vertical VOR is similar to the horizontal VOR. If the participant is using the thumb as a target, ask them to rotate their arm 90 degrees so the thumb is now in the horizontal position. The head will move vertically instead of horizontally at 180 beats per minute for 10 repetitions.
Next things I'm going to ask you to do are moving your head. And I'm going to get this little metronome that'll help you go the speed that I want you to go. So it's pretty fast. So I'm going to hold the target, and this is 180 beats per minute. I'm going to have you move your head and focus on that A at that speed, and you're going to go about that big, okay? 2, We're going to do 10 of those. A little bigger. 6, 7, 8, 9, 10. Good. And start. Okay. So, Cindy, at this point, on a 0 to 10 scale, how about now? Do you have any headache?
2.
Still a 2. Any dizziness now?
4.
4. Okay. Any nausea?
0.
And any fogginess?
None. 0.
Okay. All right. Is that dizziness settling down, or is it staying up at the 4?
Staying at the 4.
Okay. All right. We're going to keep moving on to the next test, which is going to be the same thing, but going up and down at that fast speed. So I'm going to have you go up and down 10 times. Nice and big. 2, 3, 4. Good. And then pause a moment. So, would you have any trouble seeing that A for me? So, 0 to 10, headache now,
2.
dizziness,
5.
nausea,
0.
and any fogginess.
0.
Visual motion sensitivity, or VMS, tests visual motion sensitivity and the ability to inhibit vestibular-induced eye movements using vision. The participant stands with feet shoulder-width apart. The examiner stands next to and slightly behind the participant, so the participant is guarded and movements can be easily performed. The participant holds an arm outstretched and focuses on their thumb. Maintaining focus on their thumb, the participant rotates the upper body as one unit at an amplitude of 80 degrees to the right and 80 degrees to the left. A metronome is used to ensure the speed of rotation is maintained at 50 beats per minute, 1 beat in each direction. 1 repetition is complete when the trunk rotates back and forth to the starting position. 5 repetitions are performed. Demonstrate the movement, speed, and amplitude required. After 5 repetitions, wait 10 seconds, then ask the participant to rate the following on a scale of 0 to 10. Headache, dizziness, nausea, and fogginess.
All right, so the last thing we're going to do is standing, and I'm going to ask you to move your whole body this time. I'm going to use that metronome again, or 50 beats per minute. So I'm going to have you face forward here, Cindy, and focus on your thumb. And what you're going to do is you're going to move side to side in a nice big arc, but you're going to go at this speed. All right, so I'm going to have you face out that way. Hold your thumb out, keep your eyes and head on your thumb, and you're going to go side to side. So a little faster, so you go 1, 1. We're going to do 5 of those. 2, 2, 3, 3, 4, 4, 5. Good, and wait. All right. So I'm going to give you a couple of seconds before I ask you about symptoms. All right. So how about now? Any headache still?
2.
All right, 2. Any dizziness?
5.
5. Any nausea?
0.
And any fogginess?
0.
All right. There you go. All right. Thanks, Cindy.